Hello and welcome to Reality Check. India has crossed today the 2 million mark or the 20 lakh mark of COVID. Deaths are over 40,000. But the government claims that the pandemic is under control. We did a reality check of the numbers to see exactly what is the correct picture, and the picture is complex. So let's just look at where now India ranks. As we just said, by crossing the 2 million or the 20 lakh mark, India is now the third ranked country in the world when it comes to COVID cases. After USA and Brazil, India is the third. But the 2 million or the 20 lakhs is misleading, say experts and the government, because India has a huge population. And so what one should look at is really cases per million of population. And if you look at that, India is actually not doing that badly at all. India is actually at 94th rank when it comes to cases per million. It's much below USA, Brazil and Russia. India has only about 1,400 cases per million compared to these countries where they run into several thousands per million. And also if one looks at deaths per million, which is also an important indicator of how dangerous or how worrying the COVID situation is in India, India again is doing well. It is at the 93rd rank. It's again much below countries like USA, Brazil and Russia. These are all hotspot countries. India has only 29 deaths per million compared to these countries where the deaths run into several hundreds per million. But could these low figures also be because India is still not testing enough? We're testing much more than earlier, but it's still very low compared to these hotspot countries. Let's look at tests per million, and you have countries like the UAE, Russia, USA all testing in lakhs per million, UK 1.4 lakh a million, Italy 1.1 lakh per million, and India is right at the bottom. It's just doing about 14,000 tests per million. In fact, in what is also worrying for India, the growth of infections is outpacing the growth in tests. So if you compare the last week of April, an average, versus July 31st to August 6th, which is in a sense the present week, the average daily tests have increased by about 1,000%, 1185%. But the average daily cases or positive COVID cases has risen by over 3,000%, so almost 3 times as much. The other worry is that these cases are not just coming from older hotspots like Delhi and Mumbai, which are actually doing better. The rate of infections there, number of new cases is coming down. But newer hotspots are emerging, especially in the south of India. If we look at that, Maharashtra, of course, continues to top the charts with almost 4.8 lakh cases, but Tamil Nadu is now steadily at number 2 with about 2.8 lakh cases, Andhra with about 2 lakh cases, Karnataka at 1.5 lakh cases, and then we come to Delhi, Uttar Pradesh, West Bengal, Telangana, Gujarat and Bihar. But even these low-ranked states, particularly in the Hindi belt, while the numbers seem low, it may also be because they're not testing enough. So what we've done is we've mapped the tests per million of these states compared to the deaths per million of these states to say whether, given the amount of deaths that are taking place in these states, are they testing enough? And this is the chart. If you can go full frame on this chart, and we'll give you an idea of what exactly this means. So what you're seeing at the lower left-hand corner of your screen, states like Gujarat, West Bengal, Bihar, these are testing very less. So the deaths per million is low, but they're also testing at a much lower rate. States like Andhra Pradesh and Tamil Nadu in some ways are closer to a sweet spot. They're testing very high, but the number of deaths per million is still low. And look at Delhi all the way out there, almost an outlier. It's testing very high, tests per million is amongst the highest, but the deaths per million also in Delhi is high. In Maharashtra, it's somewhere in the middle. So it's those cluster of states, Telangana, UP, Gujarat, West Bengal, Bihar, and to some extent Karnataka, where there is a concern because they're just not testing enough. So we don't know whether the numbers are accurate or not. All right, joining us tonight on Reality Check, we have with us leading voices from all these hotspot states. We have Dr. Tatya Rao Lahane, who's Director Medical Education and Research for Government of Maharashtra, who's kind of overseeing the state's coronavirus response. We have Mr. Pandya who's the Minister of Culture in Tamil Nadu. Thank you for joining us, sir. We have Dr. S.K. Sareen, who's the Director of the Institute of Liver and Biliary Sciences, and he was also part of the efforts to track Delhi's progress when it comes to coronavirus. And from Bangalore, we have Giridhar Babu, Professor Head Life Course Epidemiology at the Public Health Foundation of India, who's working closely with the Karnataka government. Let me just start with you, Dr. Lahane, because what we're seeing is an interesting phenomenon when it comes to Maharashtra and Mumbai, that on one hand, Mumbai has done very well. The number of infections and fresh cases has come down, but Maharashtra, Lane Saab,
Yes.
still very high, almost 4.7 lakh cases. So what's going wrong? Something went right, but also something is still going wrong.
It is not, nothing has gone wrong. Why this has happened? Because in Mumbai, the disease started very early. That was the 9th of March. But later on, what has happened, when the Mumbai got controlled, and in June, when the people were asked to go to their villages, and the people from Pune and Mumbai, where there is an industrial belt, they went to the district places. And when they went to district places, at district places, everything was taken care, that they were quarantined or everything was done.
Okay.
As you know, this is a new disease. What has happened, it has spread in that area where it is a rural area. And so because of that, today it is seen, it is increasing in the area where you can see the Nagpur. It is constantly going up, it is not coming down. Or you can say now Kolhapur and Mirrors, it is increasing. So I think this difference between these two is 1 month.
Okay.
So as we have controlled the Mumbai today, so like that within 1 month, these all areas also will also come under control, because the same strategy is applied to that places also which was applied in Mumbai, which is successful here. So I think that will also be successful in that area, because here what is important we are doing is contact tracing, and in that contact tracing we are
Yes.
for one trip like that.
Okay. So you're saying that basically the problem now is the new challenge for you is that it is now spread outside of Mumbai and it is now spreading in other parts of the state, the not so urban parts, but you're trying to almost in a sense replicate the Mumbai model and to try and curb it there, but the numbers do remain worryingly high. Mr. Pandya, if one looks at Tamil Nadu, which is the number 2 state with 2.7 lakh cases, again Chennai was the big kind of engine of the surge in Tamil Nadu, and I remember speaking to you, there were all kinds of efforts to try and contain the situation in Chennai. Has that been successful, and if so, how would you explain the fact that the numbers are still surging?
Yeah, firstly, Vasu, you need to look at another number than the total cases.
Okay.
You know, you're basing your entire analysis on total cases. Okay. You should be looking at the active cases. If you look at the active cases, Tamil Nadu is currently well behind Maharashtra, Karnataka, AP. Okay. We are only about 53,000, and we have consistently been reducing for the last 14 days in terms of the active cases. If you look at Chennai, we were an active case base of 40,000. From there, over the last 1 month, it's fallen to 11,000. Okay. As of today, it's only 11,000. It's become 1/4 of what it was a month back when NDTV covered the efforts in Tandayapet. You know, if you really look at the kind of work we are doing in terms of the 60 model that I spoke about, we have been adhering to that very systematically. And as you know, we test the highest among all the states, 30 lakhs tests, even per million. We are the third in terms of the testing. If you look at the testing percentage among the states per se. And another thing in terms of our death rate has been one of the lowest. We've been managing to contain it within about 1.56%, the death rate per se. And in my view, okay, today almost 22 districts out of 37, there is a falling trend as far as active cases are concerned. If you look at total cases, it has three components. It has the dead people, it has the people who are active cases, it has the people who are discharged cases. And that's really misleading. So you need to look at the active cases where we
fair
are
enough.
falling very steadily.
I take your point. I take your point, and I was also just cross-checking the data from our own dashboard to just to cross-check. Not that it would imply that you're providing wrong information, but you're right that your active cases overall in India, the active cases, it's a pretty good picture because of the the 19 lakh infections, 13 have recovered, so it's about 6 lakhs who are active. But in Tamil Nadu, you're right, you have about 54,000 active cases, which is much lower than Andhra, which has 80,000, and somewhat lower than Karnataka, which has about 73,000 active cases. So to that extent, it's well, it does seem to suggest that things are not as bad as the headline figure shows. But when it comes to Karnataka, now if I could just bring in Giridhar Babu. Now, Mr. Babu, Karnataka has always been interesting because it actually started off, unlike some of these other states, it was doing well and then things started to unravel. What do you think went wrong with the strategy, the government strategy in Karnataka, and what is being done to fix it? Mr. Girdhar Babu, can you hear me?
Yeah, I can hear.
Yeah.
So, the Karnataka state started off well, in the sense that the implementation of the lockdown was good. Therefore, they never allowed establishment of local transmission in that phase. And also the testing rates were good from the beginning. However, with the unlock version starting, the local circulation is going on there, and still there is increase in capacity of testing and also in terms of how the ILI survey is done. In fact, Bangalore has the highest ILA, influenza-like illness surveillance system.
ILI stands for influenza-like illness, just to...
That's correct.
But no, but in simple terms, why I wasn't able to understand. You're saying that you started off well.
Been able to pick up the cases well and
yeah, but no, I'm just trying to understand. Mr. Babu, what went wrong in Karnataka? Are you saying it was simply just because of the unlock?
No.
Or did the government get a bit complacent and take its eye off the ball?
No. I think we need to put things in context. The number of cases were low during lockdown only because the lockdown implementation was well implemented in Bangalore and other parts.
Yes.
After the lockdown is lifted, there is establishment of local circulation, and no city, no state is immune from having surge in cases, and that's what we are seeing in Bangalore. Instead of saying what things went wrong, I would say that this is natural progression of the outbreak in all the cities in the India. So the point now we need to consider is how do we handle the surge in cases? How do we save as many lives as possible? So that's the only goal, either in Bangalore or any other hotspots that you are talking about.
Okay. Dr. Sareen, when it comes to Delhi, as we were saying, Delhi has really been, it's just, if you just go by the numbers, it is quite remarkable how the numbers have come down. But there's one concern, and I just want to put up this graphic, which has to do with the rapid testing that Delhi is doing, and this is happening across the country. What is called rapid antigen tests are being done. These are much quicker. You can get the results in about 15 to 20 minutes, unlike what is called the RT-PCR, which is the gold standard. That can take much longer. But the worry is that these tests are not very reliable. The antigen tests are not very reliable. Now, Delhi and Karnataka are doing about 60 to 70% of all testing has now become rapid testing. Andhra Pradesh, again, 40 to 50% has become rapid testing. So, the RT-PCR tests are coming down, and many states are opting for rapid testing. But as I mentioned, there's a risk that these aren't reliable. But the numbers that Delhi is putting out, Dr. Sareen, and other states are doing this, is that they're mixing up both rapid and RT-PCR and putting them as the numbers. So is that a bit of a concern when you look at Delhi's supposed turnaround?
Well, you are very good in your statistics and data. I admire Srinivasan. You have just done like a doctor or an epidemiologist. Rapid antigen test has a limitation that it will pick up only when the viral load is high.
Yes.
It may miss up 5 to 10, sometimes even 15% of the people, but that's acceptable for any new test. We have to be cautious. But I want to give you a different perspective of this thing. You know, about in May, there was a antibody survey just to find out the proportion those who are exposed, and that
Yes.
was about 1%.
Yes.
An antibody survey was done in the end of June and July. 24% of Delhi was exposed,
Yes.
and only 0.6% were positive. My feeling is every month we will be having 5 to 7%. Maybe when the results of the current survey come out, I don't know, maybe 30% of Delhi would have been exposed, while infected is 0.8%. If we are doing like this, that silently we are doing and getting the immunity, it's not bad, but no deaths. So Delhi has done 3-4 things very well. One thing is every death is analyzed and the number of deaths are coming down. All the protocols are standardized. Earlier there was a hotspots all over the country. Now a patient goes to a hospital, antiviral, plasma,
Correct.
antibiotics, steroids, everything is standardized.
Correct.
Third, the important part is contact tracing is to perfection. So I think that is one of the things. But having said all that, we can still have a second wave.
Okay.
We can still have a problem because till the time rest of the population gets 70-80% immunity,
Right.
you are still having a possibility of recurrent infection.
Fair enough. Let's hope that doesn't happen. I would just like to say this, that when it comes to contact tracing, I would hesitate to jump to any conclusions about contact tracing being perfect in Delhi. We've done a fair amount of reporting of this, and also just from experience of people we know who've got infected. There's virtually been no contact tracing. I think there was contact tracing initially, but it's come down dramatically. So I think that has been a problem, but despite that, the numbers are not bad.
There are two reasons.
Yes.
Sorry to interrupt. Two reasons. One is earlier all the hospitals were only doing, you were asked to go to X hospital, they were sampling labs who
Yeah.
were collecting. Now you can go to any lab, anywhere, and not even a prescription is needed, and people are educated. So self-testing and motivation is there, but yes, there is a possibility of a cluster. If you haven't got tested,
Yeah.
then and you are staying in a house, you will make 4 or 5 people infected. So I would say the social distancing should be changed to dressed. I've used this term. Dressed means you actually have a social distance, you have a social responsibility, and finally a social discipline.
Okay.
Unless you have that social discipline and responsibility,
Yeah.
you are going to spread, and all cities,
Okay.
all provinces will become the same. We
Right.
have to have that responsibility.
Okay, but there's of course also the responsibility of the state to make sure that it is, also monitoring and being vigilant. But Dr. Lahane, about the rapid antigen test, is Maharashtra also doing a lot of rapid antigen tests? And if so,
No,
isn't that worrying?
Srinivasan, Maharashtra is doing the test, but it is not more than the RT-PCR test. So we are doing the test where hospitals, basically those who are coming in casualty.
Okay.
We are doing the test for the patients who are to be shifted to COVID ward, and then we are doing the RT-PCR and confirm patient shift to the ward. So it is not that then and another we are doing the spot where there is a we are doing surveillance and that
Okay.
the number is not more like other places. But
Okay. So you're saying that it's you are doing it, but it's not that worrying. But when it comes to deaths, Mr. Pandya-Rajan, the point as Dr. Sareen was making earlier, that there was a worry that while it is very reassuring to see that overall in India the deaths per million is low, and individual states also it's low, there was this concern about whether the figures are accurate and whether there's some amount of fudging or attempting to cover up. We know that it happened in Tamil Nadu as well. You had to add some uncounted deaths later. There was a bit of a controversy over it. But now, are you saying that all the deaths you're reporting are being reported accurately?
See, absolutely. I think the confusion, as you're mentioning, there's no confusion there. There's always an interpretation issue as to the real cause of the death.
Right.
When 82% of the cases who are dying, they have comorbidities, whether it is through the diabetes or hypertension or the heart disease that they are carrying, that the death has occurred, or it's COVID which has been responsible. There have been a lot of interpretation issue. ICMR has been periodically, because it's, we set up the task force, put that for reconciling, exactly like the way Delhi and Maharashtra did. And don't forget, if you compare a UK, which overnight changed the numbers by 4,000 deaths, or even China, which after everything has happened, many weeks later, they just quietly announced another 2,000
China is another ballpark.
No, I mean in the sense.
But I just
I think often I see in your NDTV people from US, especially Deshis who have gone there, making comments like in India, death recording is not accurate. Sitting in US, when they make comments like this, I feel like very insulted. Honestly, it's very tough to. It's very tough to account for a death
let's get,
easily in India.
Okay, let's get quick last comments from everybody. Just to share, because you're all experts, you're in the thick of it, maybe there's some learnings that can be transmitted to each other. Starting with you, Dr. Babu, if you were to identify one big positive or one big learning from Karnataka that perhaps other states could, what would that be?
No, I think focusing on reducing deaths should be the goal for every city, every state here. And then just to give you the perspective, India's, as you said, is 27 deaths per million, whereas more than 100K deaths, if you take all the countries, it's around 157 deaths per million.
So reducing
whereas
deaths,
Delhi is around more than...
You're saying reducing deaths should be a priority. How?
Yeah.
Very quickly, how would you do? How did Karnataka, or how would you say that? What's the way of doing that? How do you reduce deaths?
Yeah. So at this stage of the pandemic, we should be looking at community-wide surveys of influenza-like illness and then do testing and early isolation. By doing that, we'll be able to contain the transmission and reduce the deaths.
Dr. Sareen, any one learning from Delhi?
Well, I would say very good management protocols. Although plasma is not a bullet, but it's readily available in the first plasma bank. So using plasma, and of course, early going to the hospital, and no deaths, 0 deaths will be the ideal time, and we all are working for that. And of course, infections you can't really contain, but no second wave, we should avoid it.
Mr. Pandyarajan from Chennai, Tamil Nadu.
Our greatest learning is blending traditional Indian medicine, especially Siddha and Ayurveda and yoga during the treatment protocols have been a very big learning for us. I think we've been able to reduce dramatically the death rate here, largely because of that.
Hold on.
NDTV seem to think otherwise.
I have to push back a bit on that, because we debated that, and there were people, respected scientists, epidemiologists, who said that the evidence that traditional medicine can be used to fight coronavirus is not convincing at all. So I don't know if
unfortunate.
We should promote that as a learning.
Experience.
Our
personal experiences has been very good.
All
right. The traditional antipathies should vanish in this period.
All right. Fair enough. Thank you all so much for joining us. We're completely out of time. It's been a pleasure to have all of you. Thanks so much for watching Reality Check. Good night.